So, Tarek, a common question I receive is around non-menstrual vaginal discharge. So, a lot of women think that it's unhealthy to have non-colored discharge, such as white or kind of see-through, and they're often concerned that this requires ghusl, religious purification. So, can you shed some light on this and how women can approach this topic?
Sure. So anything that exits from the privates, a male or female private organ, requires wudu.
Mhm.
In addition, if what comes out is sexual fluid or the result of contact of the penis and the vagina, or menstrual bleeding or postnatal bleeding, those require ghusl, because inside the ghusl is also wudu. So think of it that way. Again, anything that exits from the privates requires wudu. In addition, if it's sexual fluid, sexual contact, menstrual blood, postnatal bleeding, it also requires ghusl. So coming back to the question, a woman has discharge. It's not a result of sexual activity. It's not a result of sexual contact. It's not a result of menstrual cycle or postnatal bleeding. Therefore, all she has to do is make wudu, regular wudu, as you would like if you use the bathroom or something like that. She
Right.
doesn't have to make ghusl. So if you think of it that way, I think it's easy to remember the ruling.
That's a great clarification and a really great reminder of how to distinguish. Now I'm going to add a bit of complexity because I just thought of another
Of course,
related
yeah.
question. There's always complexity, right? So a question I receive is a couple engages in intercourse, the woman performs ghusl, right? The next day she notices that she has additional discharge, semen discharge from that intercourse the day before. So now the question is, do I perform ghusl again?
Well, that's a good question. So if it's not her sexual fluid, then I would say she would only have to make wudu. But if what is discharged later is her sexual fluid, then she would have to make ghusl. I mean, I wouldn't even know if there's a way of knowing the difference in this case, but technically that's how I would answer the question. Now, if
Yeah,
there's doubt because of the the proximity of the discharge from the sexual act, you could be on the safe side and just make ghusl just to be in case, just to be on the safe side. I mean,
that's a good clarification. From my physiological understanding, if it was female sexual fluid, it's usually during the act that would happen, and if it's a day later, it's probably from the vagina, so it's probably the male sexual fluid in most cases.
and if that's the case, which I'm sure it is, and I vaguely remember the same thing
Mhm.
that you're saying, then we would assume the dominant assumption then, therefore, is that it's semen from him, not from her, and therefore
Yeah,
it would just require wudu, because anything, as we said, that exits from the private areas would require wudu.
perfect. Thank you for clarifying that. That'll be really
My
helpful.
pleasure. Thanks.